All right, so we've done the admission note, we've admitted the patient into hospital. Now it's time to assess how they're going since they've been in. And this is where the progress note takes place. So the progress note is essentially a ward round note. You write it as you go and see the patient, and essentially you're just trying to work out how the patient's going, if they're improving, getting better, or staying the same, and if there's anything that's changed or anything new that's surfaced. The thing with patients that you need to understand is that yes, you've assessed them when they first come in and they've presented with a few different things, whatever it may be. Now, these things can also be issues during their hospital stay, but they can also have new things that come about. Don't have the blinkers on and just focus on the issues that you want to focus on. Have to take them off and focus on everything about the patient that may make them sicker or may impact their hospital stay. You don't need to go into detail about every little thing that the patient has wrong with them, but you need to focus on things that are relevant in hospital and relevant to their medical history. So essentially, the way I structure a progress note is very similar to an admission note. The main thing with a progress note is you start off with the title, who was there, who attended, and also put in your page number. So you might say general surgery, and then if there was a registrar there, then you put registrar ward round, and you know, who's a famous person? Let's say it's DiCaprio. DiCaprio. So if I was writing it down, you write down the most senior person in the ward round, and then you either can list all the other people, but I can't be bothered doing that, so I just put et al. And that essentially means, yes, DiCaprio was the most senior person there, and then there was a bunch of other people who were less senior than him there. Then you put down your pager number, and you say what happened. And you start off with a one-line summary, very, very similar to the admission note, but the one-line summary changes. So maybe, you know, the guy in the admission note who had appendicitis, maybe he got an operation, and now we're seeing him for the second day after his operation. So I would do this. 35-year-old male, day 2, post lap appendicectomy. So what does that mean? Well, that means that if we're seeing a 35-year-old male, he's 2 days after his procedure for a laparoscopic appendicectomy, which essentially means, you know, keyhole surgery to remove the appendix. That's it. Now, you don't need to do anything more than that unless it's relevant. You know, one thing that you could mention if it is, you know, maybe he got really, really sick during his operation and needed to go through ICU. So you can put down, you know, reviewed in ICU for hemodynamic support or something like that, you know. But if he's not in ICU, then you don't need to say that. So just backspace it. The next part of the progress note is you go through the review. And, you know, surgical ward rounds are notorious for being short, sharp, and to the point. But I think that's really, really relevant in this case because this guy doesn't really have much wrong with him apart from the acute issue that wasn't because of a bunch of other medical conditions. You know, appendicitis just flares up like that in a whole bunch of people for random reasons. And it's got nothing to do with, you know, do they smoke or do they drink or do they have heart disease or whatever. You know, some people get appendicitis, some people don't. So for these particular patients, you don't need to go through a whole bunch of things. You just focus on the very pertinent points. So, you know, for most surgical patients, you know, you want to know how their pain is, you know, are their bowels opening? Do they have any shortness of breath or chest pain? I guess the main thing is if a patient's in pain and they're not breathing properly or it hurts the cough or do big breaths in like deep breathing, then it might predispose them to getting a chest infection. So that's why it's really important to control the pain so the pain does not impact other parts of their body like their lungs. The other thing you want to know is, you know, have they been, you know, moving around? and eating and drinking, or do they have any nausea or vomiting? So these sorts of things are like really important for a post-op surgical patient. The next thing you got to do is same for the admission note, is you want to note their observations. So, you know, their heart rate, their temperature, their respiratory rate, you know, their blood pressure, etc. And you want to know their exam findings too. You know, have a feel of their tummy. Are they in pain? Are they not in pain? You know, how does their wound look, especially if they're a post-op patient? Do they have a catheter in, or do they have a drain tube in, and what their outputs are? Those are really, really important bits of information that you need to look at. I mean, if a patient for, you know, a different specialty, maybe they're a medical specialty or somewhere else, you would, you know, look at other things that are going on with them. Maybe they're on oxygen, or maybe they're getting fluids in or something like that. You know, you want to listen to their chest or their heart, or, you know, have a look at their legs or their eyes. It doesn't matter. Whatever team that they're under, you just note down your exam findings and also their obs. After that, you know, sometimes I put it also in the review section, review/progress, but you can also put it in like the investigations part as well. You know, maybe they have an uptrending white cell count, which might suggest a worsening infection. They might have, you know, reduced EGFR, which is like their kidney function, which might suggest an acute kidney injury. So like looking at their bloods, you know, can give you an indication of how the patient is progressing or not. You know, maybe some results came back and maybe they have a urine infection. Maybe they did a chest x-ray which shows some like lobe collapse, which might mean that they just had some, you know, lobe collapse after their operation, and they're not breathing in properly, and they might need to be seen by some chest physiotherapists to help them with deep breathing exercises or get on top of their pain so they can do that. You know, whatever it is, you just comment on the investigations, how they've changed. And if you haven't ordered any more investigations or nothing has really changed in that, then you can just say it's like stable, or, you know, nothing's essentially changed. After that, I probably don't put an impression, but then I put a plan in. And the plan is really, really important for the nursing staff and other team members who are consulting on this patient for the day. Essentially, the way the hospital works is everyone in the morning will have their own patients, and they may or may not have other patients that they're consulting on or giving advice for. And these patients, you know, so everyone, what everyone does to start off their day, apart from like different specialties like ED or, you know, anesthetics or something like that, you know, and start their ward round for their particular patients. They go around and see every one of their patients, like figure out how they're going, what's wrong with them, and what the plan is for that day going forward. Once you put in a plan, then other people looking after the patient, the nurses, the allied health, the other doctors consulting on them, can see what your intentions are for that particular patient and how they can adapt their particular plan or suggestions. So it all sort of links in with each other. So make sure your plan is clear and concise and to the point, and that you can submit your ward round notes very, very quickly, so that everyone has a good idea of what the patient's trajectory is for that day, and that you can, the whole hospital can move around that, and it's not stuck waiting on you for waiting on your plan for the day. But yeah, that's essentially the ward round note. And what you can do, I mean, like you can have the template there. It's very straightforward. It's just, you know, the title, who attended, and, you know, what your page number is, a one-line summary of who the patient is that you're seeing, you know, what's changed in their review. The other thing that people like to do, if there's a lot of things going on, you might comment on a few things as issues. And some people do it like this. So on medical wards, you might have inpatient issues, And it might be, you know, maybe they have a COPD exacerbation. Maybe another issue is they have an AKI, which is acute kidney injury. Maybe they have, what else would they have? I'm not too sure. Maybe they have some atrial fibrillation that's stirred up because of all this AKI and exacerbation of their COPD, their lung condition. Maybe they use a lot of alcohol and maybe they're having withdrawal symptoms. Maybe that's it. So if they have multiple issues and it's hard to keep track of them, like essentially this patient here has one issue they've been operated on, and now it's just monitoring how that's going and making sure other things are not getting in the way of this patient going home, then it's very easy to do it in one like that, where you just list all the things that are happening. But for this patient who has a lot of different things going on with them, then you want to do separate points with each issue. And they don't have to be like massive, like long-winded responses or, you know, notes about their progress, but, you know, they can be just quick, easy points about how each issue is progressing. Maybe it's resolved. So, you know, resolved with IV fluids and encouragement of oral intake. It really depends on what the issue is and how severe it is. Or, you know, maybe something like atrial fibrillation, like not improving with, you know, 500 micrograms of digoxin, which is a medication used to help control fast atrial fibrillation. You know, need to discuss with cardiology today about management, about further management. You know, maybe it's something like that. I'm not too sure. It really depends on the person that you're seeing. But the plan might be, you know, the main things to include in the plan for any progress note or ward round note is, you know, essentially, are they staying in or are they for discharge? And then what changes to the medications or different things that we're doing for that patient. You know, maybe the IV, and maybe they're on, you know, intravenous antibiotics and now they're getting switched to oral antibiotics. So you go switch to oral antibiotics, in brackets Augmentin. You know, maybe you need to refer to PT, OT, and social work, so to help the patient in terms of their discharge planning, or maybe they have some issues that prevent them from getting up or going home. Whatever it is, you just put it in the plan. And maybe you can say aim discharge when cleared by Allied Health, you know, something like that, so that everyone has an idea of what you're doing and what your intentions are for that patient in terms of their trajectory for that particular day. If they are going home, then what's their follow-up? So you can say outpatient clinic to be booked in 4 to 6 weeks with renal for follow-up of a new kidney disease. I don't know, whatever it is, just put it in the plan. And then you can also say in that plan, referred or booked, whatever it is. You can just make a note to know that what the patient's plan is for that day, and then also afterwards to help make the discharge summary much, much easier. So yeah, progress note is essentially a mini form of the admission note that, you know, only focuses on the acute issues that are happening for that particular patient and what the plan is for the day going forward. So yeah, it shouldn't take too long. It's very, very quick. You should just like write it down, not dwell on it too much, and then get on with the jobs which are in the plan for that particular day. Next up is the discharge summary, and this is probably one of the most difficult documents to form because, you know, especially if someone's been in for like 10, 20, even 30 days, you need to summarize everything that's gone on in that document so that the next person, whether that be a different hospital or maybe it's a general practitioner or like a family doctor. They can pick up that document and say, I know exactly what's going on in the hospital and I can make my decisions about what to do with this patient next. Hopefully that helped. Bye.